And a child in Virginia has died from flu complications. The Virginia Department of Health says it's the first pediatric death of the current flu season. We're told the child was between 5 and 12 years old and lived in the southwest region of the state. However, the specific health district where the child was diagnosed has not been revealed. State health leaders are urging Virginians to protect themselves against COVID-19 and flu, as many people are turning to hospitals for care. Health experts believe this may be the worst flu season in recent years. Kaicey Baylor explains how hospitals in Hampton Roads are managing.
The COVID-19 pandemic has reinforced to hospital leaders the need to be prepared.
While it's an increased volume, it's not a change in the work. And so I don't feel that we are in any way overwhelmed. We're just busy.
Dr. Marlene Capps, the interim chief clinical officer for Bon Secours, describes a rough start to the flu season at the hospital system as workers treat patients with COVID-19, influenza, and RSV.
Low but steady of COVID patients. And then, yes, we have seen an increase in influenza cases.
Lisa Solid with Virginia Department of Health says flu season started much earlier than expected.
A lot of ERs and EDs really are overrun right now.
According to recent data from the Centers for Disease Control, Virginia is experiencing, quote, very high activity for the flu. VDH's weekly influenza activity report shows as of last week, the state reported 9% of emergency department and urgent care center visits related to an influenza-like illness. Because of these numbers, health leaders are urging Virginians to protect themselves. But getting many vaccinated this season has become a challenge.
Our early indicators have shown that vaccine uptake is low this season, is a little bit closer to what we saw last season.
Despite flu season already being in full effect, health leaders say now is the best time to get vaccinated against the flu and COVID-19 as many prepare to gather again for the Christmas holiday. I'm Kaicey Baylor for 13 News Now.
The VDH says it's hard to determine when high flu activity will peak. Experts say over the past few years, cases start to trend down in early January. Now, with flu cases rising, pharmacists across the country are having a hard time keeping their shelves stocked with certain antibiotics and antivirals, including Tamiflu. So right now, there's a nationwide shortage, and doctors say they're taking whatever allocations they can get, using new suppliers and, in some cases, working on alternative treatments.